Welcome back to Africa 54. Uganda has unveiled its first ever stigma index to demonstrate the often silent suffering by people living with HIV and AIDS. The National Forum of People Living with HIV and AIDS Networks in Uganda surveyed more than 1,000 people with HIV. It found that 66% were subjected to gossip and insults, 40% admitted they were rejected by the family and church, and 25% said they lost jobs or were denied work because of their HIV status. Now, the forum is urging Ugandan lawmakers to create policies that fight discrimination. Now, for more on raising awareness about AIDS, we are joined by Africa 54's Ndimyake Mwakalyelye. Welcome, Ndimi.
Well, thank you, Vincent, and hello, everyone. For 27 years, the Washington, D.C. organization has hosted an annual walk and run as a way to fight AIDS. Africans in the area are joining in and embracing the concept as an effective way to spread the message.
So excited. I'm ready to see.
Along with an estimated 9,000 participants, Tinashe Basa and his fellow Zimbabweans and friends walked through the nation's capital Saturday in support of the annual AIDS Walk. Basa is the director of Zim Kids Orphan Trust, an orphanage of 200 in Zimbabwe's second largest city, Bulawayo.
It's really important that people should work together in coming up with these big events to raise awareness.
Loud music, warm-up exercises and the camaraderie uplifts the otherwise somber mood of the occasion, firing up the crowd for the 5-kilometer trek. Washington has one of the highest HIV infection rates in America, but reports show that number is declining. For many here, AIDS has hit too close to home to stay away. Why are you walking today?
I had two brother-in-laws that died of AIDS.
For my son and his friends and my family. Even if it wasn't my son who was HIV, I would walk anyway.
Reducing these numbers is why Whitman-Walker Health, a non-profit community-based organization, holds the annual event.
I always tell people one new infection is too many. One AIDS-related death is too great a loss, and so our job is to get to zero.
Some of Washington's top officials showed up in support of the event.
The walk is really to raise consciousness and to educate people so that they understand that the virus is preventable, that you ought to get tested, that safe sex is the order of the day.
I've been here each year in order to be able to let people know that we can win this battle, and people, especially at the highest levels of government, need to walk to earn dollars to be able to fight this dread condition.
Africa remains the epicenter of the HIV/AIDS pandemic, and while Zimbabwe has reduced its prevalence rates through aggressive prevention campaigns, monthly deaths from the disease still number in the thousands.
It is a personal issue because I have some family members who have HIV. Also because, the country suffers a lot from HIV, so I wanted to do something to help.
We can make a difference by letting people know about AIDS and making them aware so that they know how to help.
Responsible for bringing this Zimbabwean crowd together is Eleanor Bucket, who started Zim Kids Orphans Trust with her husband.
AIDS is a global pandemic, and it was important for Tinashe, our director of Zim Kids, to see other nations' responses to AIDS.
Also walking in honor of a lost loved one is Alice Kiho of Cameroon.
I lost a sister 10 years ago with AIDS, so today I'm walking for African people to raise awareness.
The event raised close to $700,000, which Don Blanchon of Whitman-Walker says will go a long way.
We give a fair amount of it back out both through our programs at Whitman-Walker, but also to our community partners.
Tinashe Basa of Zim Kids and his friends are hard to miss among the thousands of people carrying banners, signs, and some walking their T-shirt wearing dogs for AIDS. After nearly 2 hours of walking, Basa says he's not ready to quit.
I think I could do 3 more laps.
Crossing the finish line for many of the participants is an accomplishment of its own. However, for those fighting to end the spread of AIDS, the mission is far from over. And joining us now with more on the AIDS walk is Tiffany Gillard, Chief External Affairs Officer of Whitman-Walker Health. Thank you so much for coming in today, and congratulations for getting so many people out on Saturday.
Well, thank you for having us.
So the fact that DC has the highest number of people living with HIV and AIDS, some people will be shocked to know that the nation's capital has that problem. Why?
I think people are shocked because they feel like the nation's capital is really the U.S., that's our epicenter of education and the federal government. But we are a city, and we are a city that has been hard hit by the HIV epidemic. And for over 30 years, there have been people living in the area who have been impacted by HIV and AIDS in a very real way.
And what is the reason for that? Is it complacency because there's access to treatment? Is it just lack of awareness? And how does the AIDS walk help to reduce that?
I think over the 30 years of the epidemic, what we have seen is really complacency. And you hit it right on the head. There is still a stigma associated with being HIV positive. People are still not being tested. People still don't know their status. In Washington, D.C., over 15,000 people are living with HIV. And we know that there are probably another 20% of the population that is not even aware of their status because they won't go and get tested. The AIDS Walk brings back to the table the conversation about HIV and AIDS. This year we had the campaign theme of Face the Facts. And the reason we use that theme is because we wanted people to be reminded that this epidemic is still very real. And we still have to face the facts that people are living with HIV, but new people are being infected every single day.
So the statistics that my colleague Vincent read earlier about in Uganda, how 60 or more than 60% discrimination, gossip, and people just talking, and then more than 40% being rejected by their families and even church. Is that a reality here too?
Yes, Demi, I listened to those statistics, and I tell you what, it's very real in the U.S. While we don't have the discrimination as far as jobs and homes and people having access to benefits, there's still huge stigma that exists in our communities. Communities of color especially have been hard hit by the epidemic. And a lot of it is because in our churches and in our social organizations, we don't talk about HIV. We don't even talk about sex, to be quite honest. And until we start having the conversations about safe sex, about being tested for HIV as readily as we talk about heart disease and obesity and breast cancer, we're still going to see high rates in our communities of color.
It's a scary reality
It's
so many years into this fight.
Reality.
So as we showed in the video, there was a group of Zimbabweans. Actually, the person we featured the most, Tinashe Basa, said he had never even heard about this concept of walking for a cause. He wants to do it in Zimbabwe.
Yes.
How does Whitman-Walker help in things like that, or trying to facilitate?
So for 27 years, we've been doing the walk here in Washington, D.C., but all across the U.S., this walk is duplicated. Right. There's AIDS Walk Atlanta, there's AIDS Walk in New York. In almost every major city, there is an organization that hosts AIDS Walk. And again, it just brings back to light and it gives media coverage to the plight of the epidemic across the communities. If he is interested, it does work. It does work. We raised about $700,000 prior to and during the walk. We will keep our fundraising campaign open until the end of the year, and all of the proceeds go to benefit research and support and care for people living with HIV and AIDS, both at Whitman-Walker Health and the 13 community partner organizations that we work with.
And you said there's a significant number of Africans who visit your health centers.
Yeah, actually, while we don't segment by ethnicity to that degree, we know that over 50% of the clients who come to Whitman-Walker identify as Black or African American. Now, of that number, the number of African nationals or people who are truly of African descent, I can't tell you the exact number, but over half of our clients are people who identify as Black.
Well, I hope things will change as we keep on walking.
We've got to keep walking.
Got to keep on walking.
And got to get tested.
Absolutely.
Yes.
Thank you for that kicker. Tiffany Gillard is the Chief External Affairs Officer for Whitman-Walker Health, which organized the annual AIDS Walk here in Washington.